Well, in this morning's Two Cares for Your Health, we're focusing on keeping you well during what doctors are calling a twindemic. That's flu season during the COVID-19 pandemic. And physicians tell 2 Works 2's Karen Larson both can be very dangerous, and you might not know which one you're dealing with without expert help.
Tulsa ER and Hospital, this is Nikki. How can I help you?
Calls come in often. Patients calling and coming in about COVID.
Just simple questions so we can kind of get a baseline of whether you're likely to have COVID or not.
However, COVID-19 isn't the only illness. Emergency medicine physicians are also seeing patients sick with the flu.
Body aches, fevers, chills, it seems to be worse with the flu than it has been with corona, but it's kind of bearable with that. So
it takes a test?
Yes.
The emergency medicine specialists at Tulsa ER and Hospital say it does take testing to tell the difference between COVID and flu. Their lab is a busy place these days, especially since the flu and COVID have similar symptoms. Both may begin with headache, fatigue, body aches, chills, and fever.
What I will say is typically with flu, we see a lot higher fevers, that looks like a sudden onset of much higher fevers than what we have been seeing with COVID. Not that COVID, you can't have a fever, but the degree seems to be much higher with flu. Hello.
Dr. Mark Blubaugh says only COVID-19 affects your ability to taste and smell.
How are you feeling?
And just as COVID can hit even harder when you think you're getting better, so can the flu, with pneumonia that can progress rapidly.
So what I will tell patients, if you feel like you start getting better from the flu, and then a few days later you're having chest pain, high fevers, cough, shortness of breath, you need to be reevaluated.
There is a rapid test available for both the flu and the coronavirus. Doctors get the results in less than 15 minutes. So if you're not sure which illness you're fighting, they do recommend you come in and be tested so they can help you get back on the road to good health. It's also important to know because with COVID, you'll need to quarantine, and so will anyone else who's come in contact with you. Tomorrow, a COVID patient shares her battle and a doctor's advice on when to see your physician or head to the ER for help. Karen Larson, 2 Cares for Your Health.